This is orientation to the Pyxis for simulation lab and what's in the supply carts. So to get medications out of the Pyxis, you should already have a login. So touch the screen and it should be your first initial, your last name. Enter that and then place your finger. Now you're going to have to remember what finger you use to register. Most people use their index finger of their right hand. So now I've got the main menu up. I'm going to do remove. And now I need to select my patient's name. Now my patient's name is Derek Johnson. So I've got B's and C's here. So I'm going to push the J key to make it go to where I can get Derek Johnson. I'm going to select him. Now the things that I'm getting out, this has all of his meds here. And what I want to get out is a PCA syringe and the PCA keys. So I don't see them on this page, so I'm going to scroll down. And right here I see morphine sulfate, PCA 30 milligrams in a 30 ml syringe. That's what I want, so I'm going to select that. I need one syringe. Now I'm going to do select next item because I still have other things I need to get out. I need the patient controlled keys. So I'm going to select that. I need one set of keys. Now I'm done selecting items, so I'm going to say remove now. The drawer is going to automatically pop open. You need to pull the drawer all the way out for the bin to pop open. So here's my PCA keys. Now before I close this drawer, I need to close the plastic lid and let it click before I gently close the drawer. Then the Pyxis is going to open up the next drawer that has my other items, so I'm going to pull it out. Now I need to read my screen. This is a controlled substance, morphine, so it's going to ask me a beginning count. So I look in here and I've got 2 syringes, so I'm going to press 2 as my beginning count and accept. Now it tells me to remove. Now I want you to look at this screen carefully because it'll say remove 1 syringe, pocket A. So it says drawer 4, pocket A. Now the drawer automatically pops out, but some of the drawers have individual pockets that you need to make sure you're getting the right pocket. So I'm going to take 1 out and I'm done now, so I can close the drawer. And it's going to go back to the original screen. If I have another patient that I need to get something out of, I can go to my patient list and pull that up. But I'm done, so I'm going to say exit because I don't want someone else coming in and getting meds out under my name. So now I can go over to the IV cart that's over here in the corner. Now I can use this as an area to get my supplies ready if I want to. I've got my PCA syringe, I've got my PCA keys. Here's where the PCA tubing is. I need that. Other things that are up here are just some general supplies that you can look at. I've got cotton balls. I've got some cotton tip applicators over here, some swab sticks. The top drawer has got some syringes in it. Now the second drawer and the third drawer have IV bags. Now the IV bags that are in here are going to be bags generally that have additives in them. So think about it as something that comes from pharmacy. So I've got a bag that has 0.9% normal saline with humulin insulin 10 units in a 250 ml bag. That would come from pharmacy. That's not going to be in the Pyxis. So IV bags in here are something that have additives in them. So they are in the second drawer and the third drawer. Now, other IV bags like just regular normal saline are going to be in the Pyxis. Also, your IV piggybacks are going to be in the Pyxis. In the bottom drawer of the IV cart is your tubing. So I've got tubing that is primary tubing. You can also find tubing that is your secondary tubing. So get all of those supplies that you need before you go back into your patient room. In the cabinet that's next to the IV supply cart is our just general supply cabinet. So when you open that, it's going to have things. If you look at the top shelf, we've got treatment supplies. So I've got Foley's, I've got NG tubes, I've got some dressing supplies. The second shelf has got a little more of the same. We've got some more dressing supplies, gloves, tubes for lab, specimen cups. We've got some linens on the third shelf, and on the bottom shelf we've got extra pillows and some extra respiratory therapy things like incentive spirometers and your SCD sleeves. Also, I think I see underneath the SCD sleeves is you've got some of the emesis basins. So all of that is in the supply cart. So get all of these things that you need and take them into your patient's room and get everything set up from there.